Hello, everyone. Welcome to the A Way Forward podcast. I'm your host, Sarah Steensma. I'm an occupational therapy student at the University of Missouri, and I'm creating this podcast for my doctoral capstone project. Season 1 will target mental health in an effort to reduce stigma. Each episode will focus on a specific diagnosis, and we will have a special guest sharing their unique experience. The goal of this podcast is to normalize things and provide blanket support for families. We want to help share their story in a storytelling format as an effective way to reduce stigma and provide support. For the purpose of this podcast, all names have been changed so guests can remain anonymous. Hello, everyone. Welcome to another episode of the A Way Forward podcast. On today's episode, we have Blair joining us. Blair, thank you so much for joining. So excited for you to share your story and just really happy that you're here today. Can you tell us a little bit about yourself and your mental health diagnoses?
Yeah, thank you for having me, first of all.
Of course.
I am 25 years old. I've had mental health struggles for a long time. I have anxiety and depression that have officially been diagnosed with a doctor, and I have PTSD, or probably CPTSD, that has been diagnosed through my therapist, but we really didn't focus too much on like the actual diagnosis, more so on the like let's just fix it kind of thing. So I am a paramedic. I've been doing that for 5 years, almost 6 now actually, and I think that's where some of this has definitely worsened and stemmed from kind of through that process.
Yeah, I can imagine. That's a very high stress level job.
Yes.
For sure.
It is a very fun and rewarding job, but it definitely has its moments. And I think I've learned that a lot of people in our field don't actually know how to handle mental health. Believe it or not, medical professionals don't know how to handle ourselves, and we're notorious for compartmentalization and bottle up your feelings. Don't worry about it. Don't talk about it. It'll go away, right?
Right.
That's not how it goes.
No. Exactly. Can you share a little bit about when you were diagnosed with anxiety and depression?
So, honestly, I should have been diagnosed years ago, but I think I've always had that little bit of that ignore it and it'll go away mindset. Mm-hmm. When I was 12, my dad passed away, and so like that's hard to go through as a kid. And so that's really when things started. And then as I became an adult, I got a job that was really fast-paced at a busy service, and I started struggling with anxiety really badly. I just had these ideas that like everybody hated me and like people were talking about me behind my back, and I would get chest pain that I was just like, maybe I'm dying. Turns out I was anxious. Mm-hmm. So I was finally talking to a friend, and he described the same things and said he went and got anxiety medication and feels so much better. And I was like, wow, maybe that's a good idea. So I went to my doctor. They have the little questionnaire that you fill out and say like, oh, these are my symptoms. And she was like, yeah, let's get you something. You're really up there. So that's kind of that was the first step in getting my diagnoses. She was like, yeah, anxiety, depression, and we'll go from there. So that was the main 2 things we focused on. But I didn't dig too deep into the PTSD stuff with her. And honestly, I don't think it hadn't gotten bad yet.
Okay.
So, because the PTSD started, I encountered a situation where I was responsible for literally trying to save the life of somebody who educated me very closely. Like, he was my paramedic instructor. And it wasn't just me, it was the whole team. Something terrible happened. And we did amazing. The call went amazing, but he still passed away. Oh, so gosh. That's where the PTSD comes in.
Okay.
Because there's a lot of like, we know we couldn't have done better. We did the best we could, but still, could we have done better? Then you think about it and you have to go to the funeral and just a lot of things.
Yeah.
So that's when the PTSD came in.
Was that fairly recently?
That was about almost 2 years ago now.
Okay.
So it's been a minute. And right after that happened, we did a critical incident stress debrief, which is like so important for first responders. And I think it's highly overlooked. But we did that. I saw a therapist after that, and it was okay. Like she was okay. But then I had a couple more really bad calls where I was actually getting assaulted.
Oh my gosh.
And that, like, one of them put me in the ER. I put her in jail, kind of like.
Oh my gosh.
It was legit. So after that, I saw a therapist that was a paramedic, so she really understood.
Oh, cool.
And she knew the guy who I was like, hey, yeah, I had to help try to save him. And so we were able to really dig into that, and we actually did EMDR therapy. And oh my God, that was amazing. So that has helped a ton. So that was hugely successful for me.
Yeah, that's great. Can you share, I'm personally familiar with EMDR, but can you share just a little bit, as much as you're comfortable with, about your EMDR experience?
Yeah.
And how you benefited from it?
So EMDR, I had no idea what it was when we walked in. She was like, this is just what we're going to do. And so first we established like a safe space, right? So she would have me like tap my hands on the table or my legs or my feet or whatever, just tapping slowly as I like built this like safe space to like go to. And it almost reminds me of my version of like heaven, you know, like it's just peaceful, it's perfect, it's safe, whatever. But then as we like talked about the more traumatic things, it was like really fast tapping, and we worked through it, and it was like close your eyes and visualize it, put yourself there, like talk about it. And I don't know any of the science behind it, but it really worked, because then as we were talking about it, as we were going through it, we'd dig into it, and then she would send me back to that safe space to kind of regroup, and then like we'd go back into it. So, and eventually I've been able to like, because we did some like, we talked about my dad in EMDR, and like he was kind of fluid between like a traumatic space and then like the safe space. But now it's just like, just safe. Like he comes to the safe space, I see him there. It was
goosebumps.
Oh my gosh. There was one day we were doing it, and I swear to God, my therapist was trying not to cry because we got so deep into it. I swear he kissed me on the cheek.
Oh my gosh.
Like his mustache, it was all like, it was just weird. Like I could feel it, like his facial hair on my cheek, and like I was sobbing, she was crying, like
wow.
But it was weird.
Powerful.
Yes, and I don't see that therapist anymore, just because I feel like I'm doing a lot better. And so I've got her. I've got her number.
Yeah.
So I call her if I need anything, but I'll still do like EMDR every once in a while, just like the safe space. Obviously, we're not doing anything scary on my own.
Right.
But I'll do the safe space, and I'll like, you know, just go to my happy little happy place.
Yeah. That's a great strategy. So is it kind of like exposure therapy in a way?
I guess you could say that, yeah.
Okay.
Like that's what it reminds me of, like, because obviously I can't physically go back and like see my dad. I can't physically go back and rerun these calls that have bothered me. But that has allowed me to like put myself mentally back into that space, and like I can see it and I can smell it and I can, you know, feel it.
Right.
One of the things I notice in my my EMDR safe is that I can like feel the ground. Like it's my safe space is a boardwalk that I saw in California, and I can feel the boards under my feet. And then you walk through this like area, and there's a trash can that smells terrible, but it pulls me in, and then you go through this door and there's sea lions.
Cool.
And it was the coolest place ever in real life. It's just as cool in my safe space, but I can hear the sea lions, I can feel the boards, I can smell the trash.
Awesome.
Like it just draws me in really well. Like just all the sensory details.
For sure.
And so then it like really helps, but it's like you're there. So yeah, I guess it is a form of exposure therapy.
So cool. Thank you for sharing that.
Yeah.
So interesting. So you mentioned your dad passing away when you were 12. Can you tell us a little bit about your upbringing was affected by your anxiety and depression?
I think, so with that, my depression, I think largely stemmed from him passing away. And then it makes it hard because I've always been like super independent. So my mom's like, maybe you should go to therapy. I'm like, no, like absolutely not. I'm fine. Because there is still a stigma that if you're going to therapy, something's wrong with you. I'm like, I didn't want, like, I'm a perfectionist, right? Like we all are. It's like, you don't want anybody to think there's something wrong with you, even though, like, your dad died. Of course there's something wrong with you. Like, you've been through this huge trauma. Like, it's okay to not be okay, right?
Talk about it.
Right. Because you have to deal with it. Like, it's not something normal. People don't just do this on a daily basis. So I think that's really where it hindered, I guess hindered is probably a better word, hindered my upbringing. Just because it caused probably a lot of fights between my mom and I that I didn't need to have. Just because I was like, I'm fine. She's like, no, you're not. So, but.
And that's hard because I'm sure she was also dealing with her own.
Because now not only is she a single mom, like me and my brother are both severely traumatized, and so we've got to kind of go through all of this stuff, and none of us really know how to handle it because we've never done it before. So.
Right. Are you currently medicated for any of your diagnoses?
I am. So I take Lexapro for the anxiety primarily. That was the first medication they put me on. And I started off with just 5 milligrams and was like steadfast, like trying to hold out on 5. Had one day that I was like, this is not cutting it. And so we went up, like I called my doctor and she was like, yep. I think she had put in orders already saying like, if I ever called, just up it. And so we upped it. I did go on Buspirone for a little while. As like a supplement. But honestly, when I left my last job, I ended up going to a different job. There was like a whole string of events that kind of just hit the wall, and I was like, we're done. I need to get out of here. And ever since I left that job, I haven't needed the second med. That shows you a little bit about your environment.
Right. Chronic stress, anxieties, totally.
Well, and I think I know a lot more about myself, so I'm able to like take care of myself better. But like, they did not take care of me at my last job. I came into that job at 20 years old, not knowing anything. And I remember the first time I ran a really, really, really bad call. It wasn't as bad as like losing somebody I knew, but it was bad. And I remember I talked about it a lot because it was bothering me. And it came to the point where the person who is now in charge of that department said, stop talking about it. Yeah. So, like this young 20-year-old who's obviously struggling, who's obviously trying to like
process.
Right.
Yeah.
And everybody was hanging me out to dry. And it came to the point where he said, stop talking about it.
Dang.
And he would like yell at me. He would get me in trouble for anything, but especially that. And like probably a year later, one of the supervisors who had actually been on that call said something about it, and I could tell he was still emotionally charged about it. And I was like, wow, like I'm glad somebody else still remembers this happened. Right. And so getting out of there was hugely beneficial for me. Because now I don't need the second medication.
Right.
But
it's so interesting. So you utilize like a series of tools, like both medication and therapy and self-care and just a whole toolbox.
Yeah.
That's great. Let's see, how do I want to phrase this? How do you feel like your day-to-day now is affected by your mental health? Like, are any of your roles or responsibilities today like affected, or does it ebb and flow, or what does that look like?
I think it kind of ebbs and flows. So there will be days where I'm like really overwhelmed because I truly believe that there are more things to be diagnosed. It's just a matter of like, do they bother me enough to like get them addressed, right? So some days are worse than others. A lot of days I'm just fine. Things don't bother me at all. But, if it's a particularly busy day at work, or if we have a really bad call, or I've had patients who have had like suicidal and homicidal ideations, especially suicidal, after losing parents, after, going through really bad experiences, and we talk about it. And like, I'm not one to just pretend like I didn't go through what I went through. Mm-hmm. I've looked at patients and been like, listen, like, I get it. Like, and I've looked at people and said, this sucks. I get it. It's like, but you will survive it, and you can. And I know that because I did it. Like, mm-hmm. It is possible. It sucks, but it's possible. So those ones don't happen very often, but those ones are hard.
Yeah.
But it's beneficial for the patient, so I'll use my trauma and life experience to hopefully send out a beacon of hope. Mm-hmm. Say, like, you get the right med, you talk to the right person, and you'll make it.
That's so cool.
So
important.
Yes.
You mentioned your positive experience, like both with your therapist and then having like the open line of communication with your doctor when you were starting LuxPro and everything. Have you had any negative experiences within healthcare regarding your mental health?
Not particularly. I think because I talked to a therapist before I got with the one who does EMDR, and she was great, but I do feel like we reached a point in our sessions where I was like, I don't feel better, but there wasn't really anything to talk about. And so I almost felt like she was breaking up with me, because I was like, we just get on our calls, and I was like, hey, like, why I'm screwed up? Mm-hmm. And she was like, yeah. And we just weren't getting anywhere. So talk therapy definitely like was not the be all end all for me. And that's not to say anything bad about her. She was great. Mm-hmm. It just
didn't work for you.
Yeah, it just wasn't working. And she was actually the therapist who handled our critical incident stress debrief.
Interesting.
So she did our stress debrief after the call, and then I went and started therapy with her.
Okay.
So that was kind of nice that I didn't have to explain what happened, because it was so raw and fresh that I was just like, hey, me again, like, still messed up about that other thing, and we just kind of got into it. I do find it funny because it wasn't a negative mental healthcare experience per se, but it did help me with my mental health in a way. Because I was actually going to the doctor for a procedure that is so routine, mm-hmm. but like, girls have to do it, and you know exactly what I'm talking about. Mm-hmm. I had never done it before, and I was so nervous. And they check your blood pressure before you go in and whatever. And my blood pressure was like so high. It was almost 170 systolic, which is like up there. Mm-hmm. She looked at me. I think she looked at me like, oh, you're overweight and your blood pressure's high, blah, blah, blah. And then she goes, well, are you nervous? And I was like, yeah.
Yeah, very.
And then I realized, I was like, oh, hey, when you're anxious and your chest hurts, that probably means your blood pressure's high. Mm-hmm. So I was able to talk to my doctor about that. And I have the privilege of working with medical equipment. So anytime my chest was really hurting, I'd go and check my blood pressure and be like, oh, hey, this is a thing that's trending.
Right.
Anxiety ties to blood pressure.
Right, for sure.
So it's an interesting, she made a comment about my blood pressure being high, and it finally clicked. I was like, oh, hey.
There you go.
I'm anxious.
It's crazy. Our bodies are so complex.
Mm-hmm. It ties all in.
What negative stigma have you experienced toward mental health as a paramedic, or just, day-to-day, dismissal of symptoms, mm-hmm. or you mentioned, if you're seeing a therapist, something's wrong. Mm-hmm. What other negative stigma have you experienced?
That's the biggest one. And I think the other one that I've seen a lot of is that if you just compartmentalize it, put it away, mm-hmm. Shut it down and it'll go away. It's that doesn't happen. you can only do so many things in the world and in this job and still walk away scot-free. And I am a firm believer that anybody who does my job, like works in an ambulance for any length of time, or any kind of first responding, really, police, fire, EMS, any kind of first responding, you do this job for any length of time and you're going to walk away with some skeletons in your closet. And even if you leave them in the closet, they're going to stay there. Like, they're not going to get any better. They're not going to go away. I think that's the biggest thing. Because there's a lot of, like, oh, just don't talk about it, or, oh, put it away, or just be fine. Like, why aren't you fine? And it's not normal to just be fine. So I think that's a big one that we see, is just, like compartmentalize and stuff it down.
Have you noticed any, like, generational differences with other paramedics? Like, do older paramedics handle stressful situations differently, or, like, process them or grieve them differently?
I think that it's a lot worse in the older generations of the stuff it down. 'Cause I think as we've progressed as a career, we've gotten a lot better at realizing, hey, this job sucks in a sense. Like, it's a great job. I love helping people, but it sucks. Like, some of the things we see. And I think the younger generations are a lot more apt to talk about it. And I'm kind of in a unique spot that I'm young, but I still have experience. I started doing this job when I was 19. Like, that's pretty stinking young. And most people who start this job at 19 don't stay in it for the long term. They go to med school, they go to PA school, like, they go off and do something else. And so now I'm seeing those, like, 19-year-olds come in, and I'm getting to work with them and help them and train them. But I'll, like, sit down and talk to them about, like, and I never, like, approach them. Seems like it always just kind of happens of, like, I'm scared about that first bad call. And I was like, well, you do what you know how to do. You figure it out. And then if you need to talk about it, come to me. And I've had young ones say, like, I feel like nobody wants to talk about it. Everybody just ignores it. It's like, well, don't.
Yeah.
Like, that's how you hurt yourself. Because you're not going to be productive if you just ignore it.
Have you, like, what is your strategy for, like, because obviously when you get a call, something bad has happened. And I'm sure there's not a critical incident stress debrief after every single call. So how do you personally handle those calls, or calls on calls, like a whole day? Like, how do you handle that? So we're fortunate in the sense that most of the calls that we run are not life-threatening. Okay.
We'll run people who are sick. We'll run people who absolutely do not need ambulances at all whatsoever, but we'll still take them to the hospital. You take care of them, whatever. Those ones are easy on your mental health, obviously. And you have to, like, focus on those because, yeah, maybe it was just a sick old lady who she didn't need an ambulance. She probably could have gone in her car, but she doesn't feel good. And there's nobody there to drive her. And so you take her and you give her some fluids, you give her some medicine so she stops throwing up. And then she, like, says thank you and you move on with your life. Like, you have to take those, like, good calls as a win. And with the bad calls, I really focus on doing my best. And I know that if I do my best, that's all you can do. Good, bad, or indifferent, whatever the outcome may be, you did all you could do. Because you got in there, you busted your butt, you got sweat and blood and whatever else, medicines. I always get fluids on me, like IV fluids when I'm trying to get those set up. I always get them all over myself. You walk away, like, just exhausted, but you know that you gave everything. And so I try to focus on that. Like, if the patient passed away, it was meant to be because I did everything in my power to prevent it, and it wasn't enough. If they live miraculously, I've had calls where we've walked in and the patient has been dead, and I've walked out of the hospital and they've been alive.
Wow.
I've done it a couple times. That's incredible.
Yeah.
So
you just stick to what you know, utilize your skills, and then just tell yourself, like, okay, I did everything I could. This is my job. Now onward.
I did everything that I could, and if they live, then perfect. If not, I did everything I could. Like, that is unfortunately the circle of life of, not everybody's going to make it every time.
Right.
And so you just know that you did the best you could, and so you just have to stick with that.
Going off of that, so our series is through our A Way Forward organization, like here at Mizzou OT. So I like to ask guests as their final question, like, to talk about a time that you yourself had to find a way forward. So you've mentioned several really valuable stories. Can you pinpoint something else, or maybe redirect back to something you've already shared when you had to find a way forward?
Yeah, I guess the one that like speaks to me the most is when my paramedic instructor was killed, because that was a lot. So after we handled the call and the situation and kind of everything that was going on with him, our shift wasn't over. And I remember we drove back to the building, and I had tried to make myself cry already. I was like, my friend is dead, my colleague is dead, like, something terrible had happened. I tried to make myself cry before, and it didn't happen. But I remember getting into our ambulance, and we were driving back to our building, and I started telling my partner about the coworker who had passed, and he didn't know him. So I was telling him all these stories, and he was like, then I lost it. I broke down. I sobbed. Totally natural. But then I reached over and I put us back in service, which means we're up for another call. Because I just knew that he would be so unbelievably mad if we just started boohooing and shut down the whole city when somebody needed us. He always talked about Mr. and Mrs. Smith, which is just anybody. It's me, it's you, it's whoever calls 911, and he's like, you do what you can anytime, because Mr. and Mrs. Smith doesn't care that it's 3 a.m. They don't care that you had a bad day yesterday. They don't care that, you got dumped or your dog died. You have to go there, and you have to be there for Mr. and Mrs. Smith. And so I put us back in service. That was a terrible idea. We ended up not getting another call. I was so emotionally just deranged and disgusted and just terrified that it probably wouldn't have been the best. I was not in peak form. But for me, that was okay, we can't all walk away from this because something terrible happened. We can't just put it down because something bad happened. He wouldn't want us to, and the city will crumble if there's no ambulances, because we're all so sad. So you just have to get back out there. I took a day off the next day, so I took care of myself. But I did that. I took one day off. I went and bought myself a Nintendo Switch because life is short. Spend the money, and then you just get back out there.
Wow.
So
that's really powerful.
That's
great.
It was hard, and it was weird. Because there were many times after that where I would I'd have a bad call, or I'd have primarily weird calls, and I would be like, man, I wish I could ask him about it and get his opinion and see what he thinks. And because he was really, really gruff, and his son said it in his funeral. He said, you either loved my dad or you hated him. And I fell into the first category. I loved him. And he was such a cheerleader for me, which was a little weird, because if you got a compliment from him, it was oh my God, where's the flying pig? Hell hath frozen over. He's being polite. Compliments are flying. But he did that all the time for me, and was a huge cheerleader for me. I totally messed something up one day on a call, and I didn't know why, and I didn't know how, and I was confused. Now I know what I did wrong. I was being a little too aggressive. I was trying to put in do an intervention, and I just put too much pressure behind it was basically an IV, but a little bit different. Put too much pressure behind it. It didn't work right. I did it again, got it, whatever. Moved on with my life. But I had asked him about that one that didn't work. I was like, why didn't this work? And he was like, I don't know, but it's you, so I know you did it right. I was like, but what if I didn't? Like, that's the kind
help
of...
me, please.
Right. I was like, pretend I can do wrong. Like, pretend I did it wrong. Why do you think what do you think I did wrong? Mm-hmm. And he was just, like, always so positive, and, like, he would joke with me, and, like, at one point, I was running a call, I was still an EMT, and I was terrified because I was, like, so close to being done with paramedic school. And I was working with another EMT on a basic ambulance. And we were treating a patient who was too sick for us. So we had another ambulance coming that did have a paramedic on it. And that's normal. That's like the procedure. Like BLS ambulances, basic life support ambulances, will respond. And if you determine like, oh, this patient needs a paramedic, they will call an advanced life support ambulance.
Okay.
So it's normal. Mm-hmm. But we're standing there, and it's me and another EMT and a couple of firefighters and my paramedic instructor, who very well knows, he knows me very well, and he's very aware that I'm almost a paramedic, but I'm not. And so we're doing all the things, trying to figure out what's wrong with this lady, and we print out an EKG, and my partner hands it to me, knowing that I can read them, but legally, I'm not a paramedic. I cannot read it. So I say, hand it to him, like my instructor, and say, like, let him look at it. He can read it. And I said, I'm not a paramedic. And he goes, oh, come on. He's like, what does it say? You know how to read it. I was like, it's fine, but I cannot read it. Like, I already did, but
back me up here.
Right. I already read it, but like, leave me alone. And he leans over to another firefighter while we're still working, and he goes, so this is a BLS truck, but that one, and points at me, said it's almost a paramedic, and we'll keep it PG, a very good one at that. And I didn't know if I wanted to throw up or cry, because it's like such a huge compliment, but like a little pressure, like living up to his expectation. And he ended up counting that call, real life call, just I was getting paid. He was there as a firefighter. He counted that towards my final grade in paramedic school.
Wow.
Yeah, and he was raving about that call, just how well it went. And he turned around and made fun of me, like, for something else. But it was just weird having his, like, he was so highly spoke so
Very
highly of me. Yes.
Yeah. I feel like, too, like, that is so pivotal for your journey, like, as an EMT into a paramedic, and just the role that he has played in your life, in your career, and in your mental health, and just made you who you are today. So
yes, because he was very much a father figure. Like, as much as we were very like, we weren't mushy gushy together. Like, we didn't talk about family, we didn't talk about life outside of work. We were very professional, but he was such a father figure in that sense. And like, after my dad died, and then losing him, but like just everything he had taught us, especially raving about Mr. and Mrs. Smith, and like all of these things of like, man, he would have been so mad if I just got so upset that I encountered that I walked away. He would have been furious. And so that is kind of a motivating factor of like, well, don't bury it, talk about it, deal with it, but at the end of the day, you got to lace up your boots and do your job. So
amazing. Well, thank you so much for sharing everything, and I'm so excited for everyone to hear this, and thanks for taking the time
of course
to be with me, and thank you so much for listening. If you enjoyed today's episode, please give us 5 stars on your platform of choice, and follow us on social media at MizzouOT, capital M, capital OT, on Instagram and Facebook for weekly Away Forward tips and tricks.